Silent signs of artery blockages you can't ignore. Ever had that feeling that something's a little off, but you can't quite place it? It's easy to brush it aside and move on. But what if those small, quiet moments aren't as insignificant as they seem? Sometimes, the things we ignore are the ones that demand our attention the most. Number 1. Shortness of breath. Shortness of breath can be a subtle but serious sign of artery blockages, often showing up as mild breathlessness during daily activities. You might brush it off as stress or fatigue, but if it happens regularly, it could mean your heart isn't getting enough oxygen. The blockage in your arteries can strain your heart, causing it to work harder to pump blood. Medications like statins, beta blockers, and blood thinners can help manage this by lowering cholesterol, improving blood flow, and preventing blood clots. But medications are only part of the equation. Eating heart-healthy foods, like fruits, vegetables, lean proteins, and whole grains, is key to reducing the strain on your heart. Limiting processed foods and reducing salt intake will also help. Regular exercise, like walking or cycling, boosts circulation and strengthens your heart, while deep breathing exercises can help with breathlessness. If you notice shortness of breath, don't ignore it, consult a doctor. With the right approach, you can manage your heart health and avoid serious complications. Number 2. Fatigue. Fatigue can be a sneaky sign of artery blockages, often showing up as unusual tiredness, even after a full night's rest. When your arteries are blocked, your heart has to work harder to pump blood, leaving you feeling drained, even with minimal exertion. It's easy to chalk it up to stress or a busy lifestyle, but persistent fatigue shouldn't be ignored. Medications like statins can help reduce cholesterol and improve blood flow, while beta blockers reduce strain on your heart. Blood thinners help prevent clots from forming, and ACE inhibitors can relax blood vessels to make circulation easier. Taking these as prescribed, along with a heart-healthy diet full of fruits, vegetables, lean proteins, and whole grains, will support your cardiovascular health. Cutting down on processed foods, sodium, and sugar is crucial. Regular exercise, like walking, swimming, or cycling, improves circulation and reduces fatigue, and deep breathing exercises help boost oxygen levels. If fatigue persists or worsens, it's important to consult a doctor for further evaluation and treatment. Number 3. Chest discomfort. Chest discomfort can be a subtle but serious sign of artery blockages, often felt as tightness, pressure, or mild pain. When the arteries are blocked or narrowed, the heart struggles to pump blood efficiently, especially during physical exertion or stress. This discomfort happens because the heart isn't getting enough oxygen, and it's a warning sign you shouldn't ignore. If this discomfort is persistent or happens with other symptoms like shortness of breath, dizziness, or nausea, it's time to seek medical attention. Medications like statins help lower cholesterol, beta blockers reduce heart rate, and nitrates improve blood flow. Blood thinners, such as aspirin, prevent clots, while ACE inhibitors relax blood vessels, making it easier for the heart to pump blood. A heart-healthy diet, rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, can help manage blockages. Regular exercise, like walking or swimming, boosts circulation and strengthens the heart. If you experience chest discomfort, track your symptoms, take your prescribed medications, and see a doctor for evaluation. Number 4. Dizziness. Dizziness can be a serious, yet often overlooked, sign of artery blockages. When arteries narrow or become blocked, the heart struggles to pump oxygen-rich blood to the brain, leading to feelings of lightheadedness or unsteadiness. This typically happens when standing up quickly or during physical exertion. It's a warning sign that shouldn't be ignored, especially if it occurs frequently or is accompanied by chest pain or shortness of breath. To manage artery blockages, medications like statins can lower cholesterol and improve blood flow, while beta blockers and ACE inhibitors help reduce heart strain. Blood thinners, like aspirin, prevent clots from worsening blockages. Along with medications, a heart-healthy diet, rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, can support circulation and reduce plaque buildup. Regular aerobic exercise, like walking or swimming, strengthens the heart, while strength training supports overall health. If you experience dizziness, it's crucial to track your symptoms and consult a doctor. Early detection can prevent complications like stroke or heart attack. Number 5. Cold or numb extremities. Cold or numb extremities can be a surprising sign of artery blockages. When blood flow to your limbs is restricted due to narrowed or blocked arteries, your hands, feet, or legs may feel unusually cold or tingly. This happens because the oxygen-rich blood can't reach your extremities, causing these sensations. If you experience this regularly or alongside other symptoms like pain, weakness, or color changes in your skin, it's important to take action. Medications like statins help lower cholesterol and reduce plaque buildup, while beta blockers help improve circulation by lowering blood pressure and heart rate. Blood thinners like aspirin prevent clots from worsening blockages, and ACE inhibitors help relax blood vessels for better blood flow. A heart-healthy diet full of fruits, vegetables, lean proteins, whole grains, and healthy fats can support circulation. Regular exercise, such as walking or swimming, boosts circulation, while strength training improves muscle function. If you're noticing these symptoms, it's crucial to consult a doctor, stick to your treatment plan, and make lifestyle changes to improve heart health. Number 6. Pain in legs. Pain in the legs, especially when walking or exercising, can be a sign of artery blockages, particularly in a condition known as peripheral artery disease, PAD. When plaque builds up in the arteries, blood flow to the legs is restricted, causing cramping, weakness, or discomfort. This happens because your muscles aren't getting enough oxygen-rich blood, especially during physical activity. If you notice persistent leg pain, or it gets worse with activity, it's important to see a doctor. Medications like statins help lower cholesterol, while antiplatelet drugs like aspirin prevent clots and improve circulation. ACE inhibitors and cilostazol can also help open blood vessels and reduce leg pain. A heart-healthy diet rich in fruits, vegetables, whole grains, and lean proteins, along with healthy fats, can support circulation and reduce blockages. Regular walking or moderate exercise strengthens your heart and legs, helping blood flow. If leg pain persists, track the symptoms and consult a healthcare provider for a tailored treatment plan. Early treatment can prevent serious complications like heart attacks or strokes. Number 7. Blurred vision. Blurred vision can be a concerning sign of artery blockages, especially in the carotid arteries that supply blood to the brain and eyes. When these arteries are narrowed or blocked, reduced blood flow can cause visual disturbances. You might notice your vision becoming foggy or blurry, particularly during physical exertion or as the blockage worsens. This is your body's way of signaling that blood flow to vital organs, including your eyes, is compromised. If you experience blurred vision regularly or alongside other symptoms like dizziness or chest pain, it's important to seek medical attention right away. Medications like statins lower cholesterol and prevent further plaque buildup, while blood thinners like aspirin can prevent dangerous clots. ACE inhibitors and blood pressure meds help improve circulation. A heart-healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can support circulation and reduce blockages. Regular aerobic exercise, like walking or swimming, improves circulation. Don't ignore blurred vision. Early intervention can prevent more severe complications like stroke or permanent vision loss. Number 8. Swelling in legs or ankles. Swelling in the legs or ankles can be a red flag for artery blockages, often indicating poor circulation due to narrowed or blocked arteries. When blood flow is restricted, particularly in the lower extremities, fluid builds up, causing noticeable swelling. This is commonly linked to peripheral artery disease, PAD, which, if left untreated, can lead to severe complications. Swelling might occur alongside other symptoms like pain, redness, or shortness of breath, and it's important to seek medical attention if it doesn't improve. Medications such as statins help reduce cholesterol and improve blood flow, while blood thinners like aspirin prevent dangerous clots. ACE inhibitors relax blood vessels to ease circulation, and diuretics help reduce excess fluid. A heart-healthy diet, full of fruits, vegetables, whole grains, lean proteins, and healthy fats, supports circulation. Regular walking, strength training, and leg elevation exercises improve blood flow and reduce swelling. If you notice persistent swelling, track the symptoms and consult a healthcare provider. Early intervention can prevent further complications like PAD, heart failure, or even stroke. Ignoring the silent signs of artery blockages can lead to serious health risks. Pay attention to symptoms like fatigue, chest discomfort, or swelling in the legs, as they may signal reduced blood flow. Early detection and action are key to preventing complications. Take charge of your heart health today. Stay tuned to Grasphealth for more expert tips and health insights. Don't miss out, subscribe and stay connected to take charge of your well-being.